Kevin, we should be hearing it. Kevin?
I was crossing the road. It was very clear. I don't know where the car come from, but she like crossing and it like beeped out of nowhere. I just blanked out.
I have to hold and jog her back in because if I wasn't there, she would.
And when the car I feel very scared.
About 80% of the students walk to school, so they have to use the roadway. Most of them are by themselves.
I'm very scared when the cars are going fast.
The taxis will like drive past and drive so.
1 8 and you're dead.
Most areas that they cross, there's no pedestrian crossing, there's no crossing guard to assist them, there's no traffic lights.
There's not really any signs of safety on it. It's just open roads basically.
Slow down, save lives. These are the children's streets. They need to be able to move on them safely. And road safety is becoming a bigger issue worldwide because it's being rightly recognized as a public health issue.
So yes, the children's behavior will change, and the adults too, as a result of the children.
Well, I would say to the drivers, slow down, all right? There's no rush. Look out for the kids. Remember, they are our future. And if you destroy them, you're destroying the future.
The Most Honorable Andrew Holness, Prime Minister of Jamaica and Chairman of the National Road Safety Council, Dr. Lucian Jones, Vice Chairman of the National Road Safety Council, Mr. Saul Billingsley, Executive Director of the FIA Foundation, Mr. Avi Silverman of the FIA Foundation, Ms. Zaleka Mandela, Road Safety Activist and Advocate, Dr. Etienne Krug of the World Health Organization, Mr. Julio Urzua of the International Road Assessment Program, Dr. Paris Liawayi of the Mona Geoinformatics Institute, Ministers of Government, permanent secretaries, members of the diplomatic corps, members of the media, other specially invited guests. Ladies and gentlemen, good morning to you all. On behalf of the National Road Safety Council, I'm pleased to welcome you to this road safety seminar or webinar. Today we join with citizens from around the world to mark the 6th Global Road Safety Week under the theme Streets for Life, #Love30. This week, the United Nations seeks to bring greater attention to the other pandemic, that is road safety deaths, and to bring sharper focus to the reality that each year over 1 million persons are killed as they commute to work, school, or other social engagements. For Jamaica, in 2020, more than 400 persons were killed due to 386 collisions. This loss of lives is far too many for a country with a population of just under 3 million persons. The majority of persons being killed are pedestrians or cyclists who are considered to be among the working class. The impact of road deaths is felt on by families and communities for many years, as persons who die are typically young and are the main breadwinners to their families. For the countries, injuries arising from road crashes places a significant resource strain on our hospitals and health facilities, and oftentimes lead to individuals having a lifelong health issues. Too often, road crash victims are anonymous persons. They're invisible to the society. They are just accident victims. All lives matter in Jamaica, and we should give greater focus to the identity of the victims by saying their names, who they are, to bring to the fore their humanity and identity, and the ramifications of their deaths. Using the baseline of 2010, the United Nations included in the Sustainable Development Goals an objective to reduce deaths by half. The target was revised at the Global Ministerial Conference held in Stockholm, Sweden in 2020, and the achievement of this goal has been extended to the year 2030. For Jamaica to meet that goal, we must reduce our road deaths by approximately 20 persons each year for the next decade. This must be our decade of action objective. This is achievable if we focus on building safe roads, importing safe vehicles, essentially adopting the safe systems approach. We can apply recognized processes to rate and improve our road network, such as the International Road Assessment Program, IRAP, which the FIA Foundation has funded for many years, or utilizing the reports produced by the New Car Assessment Program, another FIA product, to determine what vehicles should be imported into Jamaica. For cyclists, we can expand the program to introduce high-quality helmets and affordable helmets into Jamaica. The helmet project being executed by the National Road Safety Council, the Jamaica Automobile Association, the FIA Foundation, and the FIA are examples of simple vaccines that can flatten the curve for road deaths. Jamaica has made good progress over the years. The Ministry of Transport and the NRC, along with other agencies, have done a great job in drafting a new Road Traffic Act. We are now awaiting the completion of the regulations to implement the law. Significant work has also been done to update the communication between courts across the country to ensure that appropriate justice is in place to deal with offenders. The Jamaica Eye, which is part of an island-wide network of camera surveillance systems designed to increase the safety of all citizens, is being rolled out. And with appropriate legislation in place, traffic offenders can be caught on camera and be fined or prosecuted. This will bring about a significant change in behavior on our roads. I wish to thank the FIA Foundation for their participation today. We welcome Dr. Krug and Julio Urzua for their visiting with us digitally. The theme for this year's Global Road Safety Week is Streets for Life, #Love30, which is really a call for us to just slow down on the roads. Each one of us has a responsibility to become an advocate in promoting the message. Let us heed the call today. It is my distinct pleasure at this time to introduce the Prime Minister of Jamaica, the Most Honorable Andrew Holness, Chairman of the National Road Safety Council, to deliver his message.
It is my honor to address you in the observance of UN Global Road Safety Week 2021 and to share in the commendable UN mission of reducing global road traffic deaths and injuries by 50% in the observance of UN Global Road Safety Week 2021. This year's observance is, in fact, part of a broader second decade of action for road safety, and we in Jamaica will be playing our part to ensure the successful design and implementation of a holistic plan to make our roadways streets for life in alignment with this year's
Kevin, it's a feedback.
this end, the government is giving serious consideration to the recommendation from the World Health Organization for policymakers worldwide to adopt safe systems.
Kevin, there's a feedback.
Government is giving roads and safe users to reducing road traffic injuries and deaths. Just under a decade ago, in 2020, Jamaica registered 260 road fatalities. The figure would not dip below 300 road traffic injuries for the remainder of the decade. Jamaica registered 260 road fatalities. The figure would not dip below 300 road traffic injuries for the remainder of the decade. Jamaica registered 260 road fatalities.
Folks, we're having some challenges with the technical presentation from the Prime Minister. Please bear with us for a moment. Thanks. Folks, we're having some challenges with the technical presentation from the Prime Minister. Please bear with us for a moment. Thanks. Folks, we're having some challenges with the technical presentation from the Prime Minister. Please bear with us for a moment. Thanks. Folks, we're having some challenges with technical presentation from the Prime Minister. Please bear with us for a moment. Thanks. Folks, we're having some challenges with technical presentation from the Prime Minister. Please bear with us for a moment. Thanks. Folks, we're having some challenges with technical presentation from the Prime Minister. Please bear with us for a moment. Thanks. Folks, we're having some challenges with technical presentation.
It is my honor to address you in the observance of UN Global Road Safety Week 2021 and to share in the commendable UN mission of reducing global road traffic deaths and injuries by 50% in the observance of UN Global Road Safety Week. This year's observance is, in fact, part of a broader second decade of action for road safety, and we in Jamaica will be playing our part to ensure the successful design and implementation of a holistic plan to make our roadways streets for life in alignment with this year's theme. To this end, The government is giving serious consideration to the recommendation from the World Health Organization for policymakers worldwide to adopt the safe systems approach. That is, safe vehicles, safe speeds, safe roads, and safe users to reducing road traffic injuries and deaths. Just under a decade ago, in 2012, Jamaica registered 260 road fatalities. The figure would not dip below 300 for the remainder of the decade. And in 2019, road fatalities hit a gruesome milestone of 440. Last year, 2020, saw a marginal reduction to 424. These are unacceptably high numbers. And we are already seeing an alarming trend for this year, with fatalities for the first 4 months at 149. We have also seen a troubling rise in the number of fatalities involving motorcyclists. And this was even prior to the onset of COVID-19 and the increased reliance on motorcycle delivery men. In recognition of this alarmingly high number of motorcyclists who have died on our road in recent times, the National Road Safety Council, of which I am the chairman, has been mandated to work with the various stakeholder groups to plan and deliver motorcycle sensitization and safety training to emphasize the wearing of helmets for motorcycle riders and pillion riders. This is a good example of the safe systems approach, as in this project, we are producing safe road users. I welcome this opportunity provided by visionary leadership at the UN and the WHO, and join with the international community in issuing a call to action to reduce speeding generally on the world's roads, and in particular in urban areas. We must enact policies and adapt strategies to combat this international scourge of road traffic injuries, which is now the leading cause of death in children and young adults in the age cohort 5 to 29. In closing, I appeal to road users in Jamaica, the wider Caribbean region, and the Americas to slow down and live. Road safety has been, by commendable and sustained advocacy over many years, inserted into the UN Sustainable Goals, to which Jamaica is committed, and international partners should commit to scaling up significantly the flow of grant funds to the developing countries where 80 to 90% of road fatalities take place, and where loss of life, cost of injuries, and the consequences of lost income is often devastating. Jamaica remains committed to playing our part, even as we fight against the COVID-19 pandemic, to ensure safe mobility and sustainable development. We want everyone to be safe, to experience the rewards of life's journey. I wish you every success in this observance. Let us continue to strive to save lives on our roadways and make them streets for life. With God's blessing, may we achieve these goals.
Hello, good morning. I am Lucian Jones, the Vice Chairman of the National Road Safety Council, which is co-hosting this event during the UN Global Week of Road Safety, as Jamaica's contribution to the global effort to highlight the importance of road safety in general, and specifically, Streets for Life. I will guide you through the rest of the program. It's my privilege to do so. And I will ask us all to remember Murphy's Law, that what can go wrong will go wrong. So we are banning Murphy from this webinar for the rest of the webinar. Thank you. We thank the Honorable Earl Jared for his very gracious but very pointed welcome, as he highlighted the data that has brought all of us from Jamaica, the wider Caribbean, the Americas, and indeed, as the panelists are introduced later, the entire world. We note also his very challenging statement that too often road crash victims are anonymous and invisible to the society and are seen as accident victims. All lives matter in Jamaica, and we should give identity to the victims by saying their names. to bring to the fore their humanity. In this context, we are very pleased and grateful that the Prime Minister of Jamaica took time out of his very busy schedule to issue a call for action on road safety, not just in Jamaica, but on behalf of the lower-income countries of the world, where the consequences of road injuries are wreaking havoc on lives and livelihoods. No doubt we'll pick up on some of these other engaging points during the panel discussions. We turn now to another equally famous person and a leader in her own right, Zweleka Mandela, the granddaughter of Nelson Mandela, but more importantly in this context, a mother who lost her child, Zenani, in a road crash caused by a drunken driver many years ago. Since then, she has become a tireless campaigner for road safety globally, and in particular, an advocate for child health. I recall very vividly her well-received speech in 2015 in Brasilia, when she challenged policymakers worldwide with the demand, no more excuses. Let's hear what Zweleka has to say to us in 2021.
I'm joining the call for action. We need low-speed, livable streets everywhere, all around the world. Our streets must be for life. All of us need safe streets where we walk, play, and live. We need to be protected from road traffic injury, where children go to school, where young people walk and cycle. We should have speeds of no more than 30 kilometers per hour. Any faster is a death sentence. This is urgent for all young people and for the rights of people with disabilities, for the elderly, for all who are vulnerable. Our streets must be for life, for all people and for the planet. We know that livable streets are good for our health. Our streets can play a vital role in the response to COVID-19, helping people to walk and cycle and encouraging physical activity. At the same time, this is an agenda for the environment. Safe, livable streets can help us move from car dependency to zero carbon travel. We are urging our leaders to take action. Local leaders, city mayors, and our governments need to listen to us. Our streets must be designed for people. Low speeds must be enforced to protect the vulnerable. We want low speeds in all our neighborhoods, in residential areas, and near schools. We want streets for health, streets for people, and streets for climate. We want streets for life, and we want action right now. These are our streets.
I can hear the applause. We need to have safe streets where children go to school, cycle or play. 30 kilometers per hour, any faster is a death sentence. Who can ignore this plea, this cri de coeur, this cry from the heart, from a mother whose child is dead because of an eminently preventable road crash? Certainly not anyone listening today. Thank you, Zweleka. The famous saying that we must think globally, but act locally comes into play as we turn next to another famous person, who in my opinion is a national treasure, as he is much sought after by the government of Jamaica and other Caribbean countries and civil society. This young man speaks to us today, not as the chairman of so many different organizations and the head of the Mono Geoinformatics Systems and a senior lecturer at the University of the West Indies, but as one who will share with us in the international setting, the local data, analysis, prediction for the future, and a constant reminder to us generally, and to me always, by his constant updates, that we need to act now. Dr. Paris Leo Ayu Jr. speaks to us now.
Thank you, Dr. Jones. Good morning, everyone. My presentation will focus on a combination of the data, the tools, and analysis that we're using to monitor and track the local condition here in Jamaica as it relates to road safety. We're not waiting until the end of the year to do any kind of retrospective analysis. We need to get right to the meat of the matter. And what we have is a road safety data ecosystem. We can't just focus on fatalities only. We need more information on injuries and offenses that happen out on the road space. But we do need to consider other variables such as the roads themselves, traffic that are on these roads, and even the environment, rain, daytime, nighttime conditions, and so on. It is in this ecosystem that we will get a sense of where we are with the type of situation that we're confronted with, and knowing exactly what to do with what's going on. So we have created a fatal crash map that is near real time, that is being used to inform policy people, the police, the general public, the media, as to what's going on out there. Different areas have different peculiarities and unique characteristics that a blanket approach to a solution may not address. So this tool, which is sponsored by the JN Foundation and JN General Insurance, has that kind of corporate support to show the kind of seriousness that we're taking. It's not one-dimensional, and we're looking at multi-scale, multi-time, multi-category systems that allow us to really get to the heart of the matter. These are the road fatality hotspots in Jamaica as of yesterday. You can see what the pattern is with respect to where crashes are happening. But more importantly, you can look at the categories. These are where the motorcyclists are dying in Jamaica. These are where the pedestrians are dying in Jamaica. This is as of yesterday. Within police division, these are the crash distributions in St. James. These are the crashes that happened in January of this year, February, March, April, May. This tool, you can zoom in, you can do whatever you want with this thing here. It's available, it's online. I've been begging people to use this thing so that you can plan your activities and take it from there. But one of the most impressive developments that we've included in the fatal crash map are not necessarily fatalities. Last year, the Jamaica Constabulary Force did a field assessment across Jamaica as to what's going on in the road network, and they came up with where they see issues with road design, road markings, issues with driver behavior like speeding, and issues like road furniture like the lack of lights. They assess the network. These are not dead people. These are physical infrastructure that the police believe should be addressed. You know exactly where to focus your intervention programs and so on. It's available. You can cross references with fatalities and take it from there. It's how we begin to integrate these different data sets that will begin to make a difference out there. But then when we look at the 3-year cumulative results, and Mr. Jarrett mentioned earlier the need to flatten the curve, and this is where we need to flatten the curve. When you look at the 3-year pattern from 2019, 2020, and into 2021, the Prime Minister mentioned the 2019 statistics versus the 2020 statistics, and we're heading in the wrong direction in 2021. We need to flatten the curve for 2021. If you look at the cumulative total for May, we already have a higher total fatalities for 2021 than at this time, than the entire period up to May 31st, 2020. We're already ahead of 2020. May isn't even finished yet. We need to flatten this curve. We need to get this trend and trajectory lower. We cannot wait until October, November to do this, by which time it's too late. We need to do this now. When we look at the categories of disease, motorcyclists and pedestrians are the #1 people dying on the roads. And when we look at causes, speeding and lane violations are really topping the scale, and also pedestrian behavior. So when we see people failing to stay inside their lane, people failing to keep left, people failing overtaking, all these things, we're seeing this type of carnage on the road all over the place. But I also want to focus you guys on what's happening at night. Not only are 66 fatal crashes are happening at night and resulting in 74 deaths, 38 of these crashes and 46 deaths happened after 8 p.m. curfew. So, and of these, 13 of them were due to speeding. So something's going on. I mean, curfew should mean curfew. And it's an issue that we're tracking right now to see, you know, what do we need to do. PPVs have resulted in 20 fatal crashes and 26 deaths, including 5 after 8 p.m. We've had 12 multi-fatality events, and in built-up areas, which is an increasing cause for concern, 129 crashes and 142 deaths have happened in built-up areas. It's important to note that the fatalities in built-up areas occurred primarily along arterial roads. These are not happening in back roads, so we need to take that safe systems approach very seriously into how road design can help to control the carnage on the roads. But we need to look forward. Right now, well, in the beginning of 2021, the National Road Safety Council said that they wanted to look at a target for the year of 350 fatalities. We're way past that. There is one death every 18 hours, 33 minutes in Jamaica right now. We have 181 deaths so far this year of 162 fatal crash events. This means that if we use the year-to-date projection, we're on track for 472 deaths for the year. If we use a rolling 365 tally, is 456, and a rolling tally for the last 2 years is 435. So we're going to go between 435 and 472. That's unacceptable. We have a target of 350 and a projected fatality count of 435 to 472. That's too high. My personal mission is to prove me wrong, to get this thing down under 400 right now. But in order to get there, in order to get to 350, we need a death rate of one death every 31 hours and 37 minutes. Right now, we're every 18 hours. And that's not going to happen organically. The graphs you see there, these are the daily, this is a daily fatality rate, and this is a rolling 7-day average. It cannot happen organically. There has to be some kind of direct intervention. Any reduction in the fatality rate right now will be the result of some targeted action. It is not going to be accidental. It's not going to be a serendipity. So finally, we need to just do anything. We just need to do something right now to reduce that fatality rate. I suggest anything ranging from reducing post-curfew traffic, looking at the most vulnerable groups, address what the police have identified as priorities based on their field observation, ranging from road markings to lightings and fixing potholes and so on. We do need to get a better grip on injury data and offenses data, collision data. But we do need to take a corporate approach. You have targets. We now know we need to hit a fatality rate of one death every 31 hours. Play towards that. We know where to focus our enforcement activities, our intervention programs. We know what times to focus on. We know which categories of road users we should focus on. And we should use the intelligence on the ground to do targeted intervention. We cannot allow this thing to continue, and we cannot depend or rely on people improving themselves organically. We have to intervene. Thank you all very much.
Thank you very much, Paris. We need to intervene. We can't depend on people to act on their own. This gives us a perfect segue into the next session, where we are going to have a panel of distinguished persons from the international community who have consented to be with us today during this UN Global Week of Road Safety. And to start off, at the very beginning, we're going to pose a question to Dr. Etienne Krug, who is the Director, Department for Management of Non-Communicable Diseases, Disability, Violence, and Injury Prevention at the World Health Organization. Etienne, good morning, or good evening to you.
Morning to you, yeah, good afternoon here in Geneva.
Yes. Etienne, the pandemic has made the World Health Organization a household name across the world. Governments and powerful voices in the media take seriously actions and pronouncements by the WHO. Which drug can be used, which vaccine, which protocols? And in that organization, you, Etienne, you are the designated leader of the Road Safety Campaign. What caused this very powerful body, the WHO, to campaign for and be the lead agency spearheading the UN Global Week of Road Safety. What is the compelling data that drive this campaign, and why the focus on Streets for Life in 2021?
Thanks so much, Lucian. That's a lot of questions, but I'll do my best to answer succinctly. The vaccine really is political will. We know what needs to be done. It has to be decided at the highest level of government and then implemented. And so that's great to see the Prime Minister here today talking to us and showing the highest level of leadership, which is exactly what is needed. And then we need to implement what's called the systems approach, which is really, and which was mentioned also, which is really tackling all the different parts of the road safety system. That means having the adequate infrastructure, making sure that pedestrians and cyclists, for example, have sidewalks and bicycle lanes to travel safely. Making sure the vehicles are of good enough quality, at least having the 7 UN standards there implemented. Making sure there's good laws, the laws are enforced and respected, and having good trauma care. So if we have a complete system like that, the deaths have to go down. There is no other direction. We are at a crucial moment for road safety. We had fantastic commitment a year ago when we all met in Stockholm for the 3rd Ministerial Conference. We had great plans, and then COVID came and in a way put a brake on all of that. But now we have since then the declaration of a decade of action for road safety with a clear target. We want to reduce deaths and injuries by at least 50% around the world. And so Jamaica needs to join us and needs to do it. One key central element for that will be tackling speed. And that is why this week we are celebrating the United Nations Global Road Safety Week and have defined speed as the overall theme. And inside that overall theme have identified a 30 kilometers per hour limit in urban areas where people who walk, who cycle mix with the traffic of cars. Why? Because if a pedestrian is hit at 30 kilometers per hour, the chance of death is minimal, maybe 1%. But above that, it increases exponentially up to 20% at 50 kilometers per hour and almost up to 100 at 60 kilometers per hour. So there's a huge difference by driving 30 or 60 for those who are outside the car. And that's what we want to promote now. Lives can be saved. I'll finish there. We know what needs to be done, Lucian. It's not a question of reinventing some kind of vaccine or finding some kind of complicated treatment. No, we know what needs to be done. It's just a question of working on it all together under the umbrella of the top level leadership. And certainly we in WHO are willing to work with all to make sure that this happens. Thanks.
Thank you very much, Etienne. We're going to take from your presentation the key words. The vaccine is a political will. And I know a number of policymakers are listening in and many others are listening to. So thanks very much. We now turn to Saul Billingsley. Saul, good morning.
Good morning.
The FIA, whose foundation you are the director, is a governing body for world motorsport and the Federation of the world's leading motoring organizations. Household names like Michael Schumacher and Lewis Hamilton are part of your legacy. But the FIA Foundation is also the leading philanthropy that funds road safety campaigns worldwide. And you, along with the WHO, have strongly recommended the safe systems that Etienne just mentioned, and the Prime Minister endorsed in his speech. As one of our radio personalities in Jamaica, Ms. Kitty, would say, what's the buzz? Why the excitement? Why the emphasis on this approach, when so many believe that it is the fault of the drivers why fatal crashes occur?
Thanks very much, Lucian, and it's a great pleasure to be here, and great to see you and to see Earl, who has served on the foundation board for 9 years and is a good friend to the foundation. And also, I just want to say thanks to Etienne for leading this UN week, and it's been a great week so far. I think we've really sort of got a unified message out there about the importance of 30 kilometers an hour. I do have a few slides to answer your question. So if I could just share my screen and see if that works. Let's see if it's going to work. As you say, it's Murphy's Law that if things are going to go wrong, they're going to go wrong. Here we go. Can you see my slides?
Yes, we can see.
Yep, great. Okay, so I've got a few slides to share about the SAFE system. At the FIA Foundation, most of the funding that we do on road safety is to try and make the SAFE system a reality. So we want to see all the things that Etienne's just talked about: safe cars, safe roads, safe road users, and to create a protective environment where people can be safe however they're acting. People make mistakes, and what we want is a system which doesn't penalize them with the death penalty or with lifelong injury for making those mistakes. And that at heart is what the SAFE system is. As well as funding these programs, which Earl mentioned earlier, we also do a lot of research. And one piece of research that we did a few years ago was looking at actually the politics of how you get change and why change doesn't happen in road safety. And we worked with the Overseas Development Institute and the World Resources Institute, two leading think tanks, and looked at three cities, Mumbai, Bogota, and Nairobi, to see how they implement or don't implement road safety and what happens. And there are three key findings I just want to talk through very quickly. The first one is that we're led by policy elites who drive or get driven, and they don't see the streets the way that pedestrians do, and they definitely don't see the streets the way children do. I'll just give you an example. This is an article that I found from one of your newspapers, The Gleaner, from a few years ago. And it's titled Careless Crossing. And it's all about this woman who is crossing a major road to get to her place of work. And the story is describing that this woman is negligent and being irresponsible. And then it goes on to point out that there's only a couple of crossings of bridges, and they're very far apart, and people are needing to get to work, and someone's recently been killed. And I think if you look at this less as careless crossing and more as careless policy making, more as careless design, you don't blame the road user, you blame the system the road user is trying to navigate, then you get to the heart of what the SAFE system actually is. Blame the road user is a real obstacle to political action. And I think time and again, I've sat on panels talking about the SAFE system and with politicians, and they will immediately revert to talking about mobile phone use in cars. They don't want to talk about system failures, but it's system failures that we have to tackle, not road user behavior. This all goes back 100 years. And in the 1920s, there was a concerted effort starting in America, but spreading around the world by the auto industry to change the way we look at how streets are used and owned. And you can see that from these two images here. On that, the picture on the left, the street is for autos. Autos are increasing, streets are not. Stay on the sidewalk or your yard, don't play in the street. These are the messages that have been given out to people for 100 years. And we've gone from having streets which were public spaces and shared, and where the traffic was necessarily slow, to streets that are essentially canyons for cars. Here's an example in New York, where whole neighborhoods were torn apart for fast traffic. We've ended up with this kind of dystopia, where children are forced to play in concrete playgrounds next to motorways. It's bad for their health, it's bad for the planet. It has huge impacts on the ability of children to explore and their basic freedom. So this is the UK. The large shape is the distance somebody could walk 100 years ago. And it's cause and effect. You know, as cars come in, and there's other things as well, like stranger danger concerns, but it's primarily about car safety. As cars come in and the streets change, the horizons of children shrink really quickly. And so you see by 2007, the little yellow dot, that's how far a kid can walk today in England, how far their parents let them walk, compared with what it was like 100 years ago. And you see the same in streets. You know, the faster the traffic, the busier the streets, the more your horizons shrink. And it has an impact not only on horizons, but on whole livelihoods. And last time I was in Jamaica, we met Anika, who had been hit by a speeding car. And, you know, her whole life and her whole trajectory had been changed by that injury. And unfortunately, we're still not learning from the mistakes. This is Nairobi, where they're still building massive urban highways, even though we know that these urban highways are essentially industrial killing machines. And you mix fast traffic with pedestrians and you have horrendous results. It's the same in Brazil, where you have massive roads which the communities don't want, and where riot police have to come and separate out communities from policymakers because they're so concerned about the safety of their children. This is what happens when you lose touch with humanity and when you lose touch with the communities that you're supposed to be trying to serve. So what we need to be doing is trying to rebalance and move away from this sort of car-focused approach on let's blame the road user, let's blame the pedestrian, let's blame the child for running out into the road, towards the safe system where we're creating a protected environment where vehicles are safe and vehicle occupants are safe, but equally the road is designed and speed is designed in a way that pedestrians and cyclists can also be safe. And this is what they've done in Bogota, and they've achieved this by putting people first. You can see the green line. They've managed to cut road deaths by two-thirds over 20 years, even as they remained pretty steady in the country as a whole, because they took the approach of catering for vulnerable road users, for putting a balance between cars and people, for making sure that cyclists are well catered for, and they have brilliant cycle lanes now in Bogota and excellent public transport as well. So they're trying to keep everything in balance. And the other thing that Bogota learned very quickly is it's really important to link road safety to other social issues that people care about, because that makes it much easier to then deliver the safe system. So they talked about it in terms of preventing violence, in terms of improving the urban environment, in terms of making people care about each other. But we're in a decade now that I would argue is not a decade of decision. Like the 1920s, the 2020s are going to be a change decade. And the main motor for that is going to be climate change, because with climate change, we all have to change our behavior, but more importantly, we have to change our systems. COVID is going to have a really big impact. The impossible inequality between rich and poor is going to have an impact. All these things are going to come into play in this decade. And we're going to have to try and find this solution to this problem we have, where we're using too many resources, the rich are getting richer and the poor are getting poorer. And what we need to try and do is be ecologically safe and socially just, as this economist argues for. And if you look at road safety and look at the symptoms of road safety, you can see that there are many ways in which we can get on board with this agenda, and we can make allies of people who want to see ecologically safe and socially just policy. Because why should this child walking to school have to stand on a concrete block in the middle of speeding traffic? This is basic policy dysfunction. It's environmental injustice, it's inequality. More often than not, it's also racism because of the way that the roads have been designed in the past or even in the present. And it's a lack of political agency for local communities. All these things need to change, and we should be making allies of people who are calling for these kinds of changes. There are many, many ways in which unsafe streets impact the Sustainable Development Goals. I won't go into them now. Hopefully you'll share the slides afterwards, or you can look at our new Advocacy Hub document that we published on Monday, which has this graph in it. But there are many good arguments for why we should be making common cause with other environmental and social campaigners to improve road safety. And I would argue that the safe system is the perfect way to do that, because the safe system essentially is it's often described as being a technocratic thing, but I think it's actually a very, very humanist thing. It's all about people. It's about protecting people. And at the very center of it is care about the vulnerable, care about the poor, care about the elderly, care about children, and designing the system in a way that you put them first and everything else logically flows from that. So taking this week, for example, if we care about children and want to make sure they're not being killed on the roads or seriously injured on the roads, then we have to look at what the policy impact of that is. The policy impact is, if they're going to be near traffic, the traffic has to be slow. And so you have 30 kilometers an hour or less. And in many other ways, the safe system also flows in that same sort of logical way. And I'd argue that the safe system has people at its core. So it's about people making mistakes and how we can deal with that. It's about the limited physical tolerances of the human body. It's about preventing crashes from death and serious injury, and it's about protecting road users. And you have to start from that point. You can't have the old technocratic approach of, oh, we can tinker with making cars a bit safer here, or we can tinker with designing roads a bit better there. You have to start from the principle, essentially a moral principle, that nobody should be dying or being seriously injured on the roads, and what are the policy implications of accepting that moral principle. So above all, I would argue the safe system is a moral principle, and until you accept that, you're not going to achieve the safe system or get anywhere close. So if you take motorcycles, for example, I know you've got a big problem with motorbikes in Jamaica. I think it starts from political and moral leadership. And we've heard the Prime Minister just now, but he does need to step up and show leadership. It's more than just making a video on UN Road Safety Week. It's about having a policy and investing in that policy and making it an holistic policy. And there are things we can do, as Etienne was describing, to make motorcycles safer. You've got infrastructure you can improve, you can reduce speed, you can introduce ABS for motorbikes, and you can introduce safer helmets. But at the core of it, you have to want to do it. And you have to have that political leadership to get all of these other things to happen. And speed underpins everything. If you have budget problems, if you don't have the money to make big design changes or to introduce new technologies, the thing you can do, which doesn't cost a huge amount, is reduce speed. And the first thing you should be doing is looking at the speeds, looking at speed management and saying, if we've got people dying and our computer systems that we've just seen from Paris show where they're dying, we should be looking at the speeds on those roads and probably lowering them in the first instance, and then making other changes as and when we can. Because if you can reduce the speed and enforce it, or even better, design it in with some road humps or some other ways of designing it, then you're going to have an instant impact on road traffic injuries. That's why this week, this Streets for Life campaign is so important. It's why we're delighted that so many people from the head of WHO down have signed on to the campaign, and we're really getting a buzz. We're really getting the message out there that streets are for people and for planet. And I just finish by going back 100 years, but also 10 years, to another headline from a Jamaican newspaper, and I don't mean to pick on the Gleaner, but it was the only one I could find on my research. But this is one about back to school tips. And in the caption for the photo, you can see it says, the absence of a sidewalk is putting the children at risk. So you can see it in the picture, you can see it in the caption. But the whole article is about what children should do to behave on their journey to school. And I just pick out 3 examples here. And these are from the Jamaican police giving advice, probably well-meaning advice, but walk facing oncoming traffic, behave responsibly. The road is not a play area. Can you see the echoes of those cartoons from 100 years ago? This is the kind of mindset and thinking that we've all been taught to live with and that we need to change. Walk only on pavements. Well, sure, if there are any pavements. So I've done a little bit of editing, and I think, this is what we should be doing 10 years on, and hopefully you are now doing in Jamaica. We should be having a back to school road safety plan, not tips. We should be slowing down the traffic. We should be getting the government ministers and highway engineers to behave responsibly, and we should be building more pavements. Nelson Mandela said, there could be no keener revelation of a society's soul than the way it treats its children. Absolutely right. And I think we all want to have societies where our children come first. His granddaughter, who it's a privilege to campaign with, says we must deliver a true revolution, transforming our streets from places of danger to places of freedom. Absolutely, the safe system is a revolution, and I hope you'll all join us and be revolutionaries, and every child has the right to use safe roads, as your famous sprinter would tell you. Thanks very much.
Wow, Saul, that was a lecture indeed. There is an old saying that it's an ill wind that blows no good. And this pandemic, which has caused Zoom meetings and team meetings and virtual meetings to virtually explode, pun unintended, it's bringing us all together in a way that we can access the kind of thoughts and the advice and the technical know-how that yourself and Etienne have both contributed so far to this webinar. I'm sure a lot of people are going to be thinking very seriously about a lot of the comments you have made, and also Etienne. And one of the things that struck me as you spoke was this matter of being economically safe and socially just. That is something I think is going to resonate well with our policymakers and also the media and powerful voices in the country. So I really want to thank you so much for that very erudite and very informative contribution. So having had Saul and Etienne opening innings in cricketing terms, we now turn to someone who we believe can facilitate greatly this balance that a country needs to have in terms of the infrastructure and other things that go with it. So Julio, you are the Regional Director of the International Road Assessment Program, IRAP, for Latin America and the Caribbean. What is IRAP all about? Why have so many countries invited you to help with road safety? Why is the theme for the week, Love 30 Streets for Life, literally and metaphorically right up your street, as your organization seems best placed to ensure success in this aspect of the safe systems approach?
Lucien, good afternoon here. Good morning still for you. Thank you so much for the invitation. Thank you for the leadership because this UN Road Safety Week has been very, very important to put on the table the topics that are important now. So I also wanted to share some slides to try to respond your question, and especially to talk about the importance of the infrastructure in terms of attaining the 30 kilometers per hour goal, and also to attaining the road safety objectives that we talk. So let me see if I can share my screen. I think you can see my screen now. Is that correct?
Yeah, we can, Brian.
Okay, excellent. So I wanted to start by talking about the Sustainable Development Goals from the United Nations. This is a very important topic because it sets the goals for all the countries that are part of the United Nations system. So 17 goals for people, for our planet. These sustainable goals are a universal call to action to end poverty, protect the planet, and improve the lives and prospects of everyone and in every planet. So they are 17 goals that were adopted by all the UN member states back in 2015 as part of the 2030 Agenda for Sustainable Development, which sets out a 15-year plan to achieve the goals. Why I mention this? Because these goals, they do have topics there that are very connected to the road safety, and specifically they are connected to the infrastructure. So goals number 3 that are good health and well-being, goal number 9 about the industry, innovation and infrastructure, and 11 sustainable cities and communities. So all of them are related to the road safety by improving the quality of life of people. And I would like to specifically talk about this goal 3.6. So this goal 3.6 developed under this one global road safety performance targets. So these are 12 targets that the countries should address in order to attain road safety. And from these 12 targets, there are specifically 2 of them that are very important and are important for IRAP purposes and for the infrastructure. So target 3, it says by 2030, all new roads achieve technical standards for all road users that take into account road safety or meet a 3-star rating or better. So it's a really clear goal. We should have minimum 3-star roads. And target 4, it says by 2030, more than 75% of travel on existing roads is on roads that meet technical standards for all road users that take into account road safety. So these are very specific and attainable goals. As Dr. Etienne Krug said, we need political will in order to make a plan to attain these global targets in 2030. So they talk specifically about the minimum 3 stars. This is a measure of IRAP as an international organization. And why 3 stars? Because we know, and there's some research that shows that a person's risk of death and serious injury is approximately half for each incremental improvement in star rating. So when we have an infrastructure that is 1 star and we make it 2 stars, immediately we are decreasing the risk of death or serious injury for people. So it is very important to have minimum 3-star roads and streets in our city. So this is IRAP calculations that we do have in a website that is it's underneath it. The website is called Vaccines for Roads. It's a website created by IRAP. It's a big data depository where we have lots of information about different countries. And our calculation, as I said before, in a country such as Jamaica, with according to WHO, with almost 400 people dying every year, with a population of near to 3 million and fatalities 14 per 100,000 population, etc. What could we achieve with this target of 75% of travel on 3 stars or better roads for all users in 2030? So we should have an infrastructure and speed management investment there, which represents 0.39% of the GDP. With this investment, we could reduce fatalities per year in 131. So it's a lot of life that we are going to be saving. In 20 years, the fatalities and serious injuries, considering that a rate of 10 serious injured per fatality, would be almost 30,000 people in the next 20 years. This has a benefit cost ratio of 4. That means that for every dollar that we are investing in getting a better infrastructure, we are going to receive $4 back by saving lives and saving serious injuries on the roads. Therefore, investing in road safety, it's a good investment, not only because we are saving lives, but also because we are making the country save money. So we need this target of minimum 3 stars. We have developed for urban environment with NACTO. We have developed a design guide that makes a comparison between roads that are 60 kilometers per hour, and we have calculated the star ratings for the pedestrians, for cyclists, for car occupants, etc., on the streets and also on intersections, and what could happen if those streets were 30 kilometers per hour. And we see that the change is huge in terms of star ratings. So they go from 3-star, 1 star, 2 stars to 5 stars on an urban environment. If you are interested in this study, you can go to the NACTO website, and also here there's a website where in IRAP we have published these results. Specifically for schools, we also have this tool that I think, Lucy, that I have also presented in the past in Jamaica, called Star Rating for Schools. This is a tool to communicate and to manage the safety around a school area. With this tool that is free to use, communities and governments and NGOs and professionals and people that are connected to education, they can use it to measure how safe or unsafe it's in a school area. It's a very powerful tool for communication, and it also is a powerful tool because it gives the user the opportunity to know exactly what are the kind of improvements that we need to do to improve the conditions. So I invite you all to use this tool to get in contact with us. As I said before, this is free of cost and is divided into a website and also an application that you can download on your phone or on your tablet. This is just, because of the time, just one example of what we can do with the tool. This was a work done by our partners, Amend in Africa. So you can create a 5-star safety environment for our children by applying some countermeasures that are easy to apply, are simple countermeasures. And as I said before, the technology is there, it's free to use, and it's just a decision of us to use it. That's my presentation. Lucien, thank you again.
Thank you very much, Julio. And we have listened very carefully to your very informed discussion and presentation. I think one of the things that would strike people is this question of return on your investment. For every dollar that you invest in terms of infrastructure, you can have a return of $4. That's huge. So you're not only saving lives, you are saving money. That's a big statement, and something which I'm sure our policymakers are very interested in. And of course, the need to have 5-star roads for children, which leads us very nicely into the next presentation. Good afternoon to you, Abby. Good morning from us here in Jamaica.
Good morning, Lucien. Thank you very much for the session. Nice to be here.
Right. So, Abby, you are the Deputy Director of the FIA Foundation and one who has worked very closely with Zalika Mandela and the Child Health Initiative, along with UNICEF. I greet you in the way members of the Maasai tribe in Africa, I'm told, with a friend. Not how are you, but and how are the children? So in that context, mindful of the terrible challenges that the children worldwide are having, and we in Jamaica can tell you a lot of stories. How are the children and young people doing on the world's roads?
Thank you very much, Lucien. That is a very good question indeed. Having just picked up my daughter from school and we walked back from school and down the road, I can say that we're quite lucky here in the safety that we have, and I know many places in the world have been improving. I want to give you a quick presentation. I'll try and share my screen. Hopefully you can see that. Actually, the two girls here are from Denham Town in Kingston, and they're on their daily school journey. I'm going to come back to Denham Town a little bit later in my presentation, but what I want to give you an outline of is really that this is a critical agenda actually across different issues. As Saul said earlier, you know, it's a social issue, it's an environmental issue. It needs to connect in, road safety needs to connect in with all those other priorities, and it does, but often that is overlooked. And getting these girls to school, getting girls to school generally as a global policy agenda has been a major global priority for many development agencies, and there's a lot more to be done on that. but road safety often isn't really a priority at all. I want to show you here a slide that we work with the chair of the Lancet Commission for Adolescence. The Lancet, obviously many of you know, very reputable, high-level academic study that it's done on health, on development and health, and on adolescence globally. And as part of his research, the chair of the commission, Professor George Patton, really broke down the figures and looked at overall development assistance for health. And this kind of gives you a reflection of priorities. In terms of the overall development assistance for health for adolescents, and this isn't road safety, this is everything. For adolescents in general, it's 2.2% of the overall spend. So really, you know, and within that actually, as you can see on the right-hand side, with road traffic injury is 0.3% of that 2.2%. So road traffic injury and other issues as well, other non-communicable disease issues, issues such as mental health in particular, are hugely neglected compared to the burden that they have on our young people. What we have here really is a kind of a double neglect, or more accurately, a neglect and a failure. It's neglect on issues such as road traffic injury, and it's a failure on adolescents and on youth really to respond as we should be doing. And this is both development agencies globally, but also governments themselves. This is something that's actually been exacerbated by COVID. So, you know, there has been some focus and spending, as I said just before, on education, particularly on getting girls into education globally. There's been some commitment that's been made by multilateral development banks, by the World Bank, by other big donors on that. There's been really, to be honest, some underfunding and under-recognition of adolescent health in general, and some key issues that adolescents face, in addition to mental health issues such as violence as well. And I know this is a major issue in Jamaica, where violence amongst young people, how young people suffer violence in various different forms, is a huge issue that is a prominent concern in the country. But globally, and from a coordinated point of view, there is not really an adequate coordinated response to that, and issues such as mental health, and equally issues such as road traffic injury. So what we've been doing and placing a big effort in working with counterpart organizations, with other big donors, with the UN system as well, is to really address this, and is to say that all of these issues need to be tackled together, and the areas in which they link together need to be recognized and addressed. And in doing that, the approach is really that, you know, governments can take that agenda seriously. If they're not taking road traffic injury all that seriously, if they're recognizing that they've got a problem with violence and increasingly with mental health as well, but the coordination isn't quite there and the commitment isn't quite there either in those areas, maybe what we need to do is bring all of those areas together, make a case to governments and donors that they should be addressing all of these issues in much more of a joined up and coordinated way, and increase the level of political commitment to all of them. And what we're working with our partners on is having a global summit on all of these issues in 2023, where we address youth and adolescent issues, particularly in response to the COVID crisis. We look at some of the need that's out there and some of the momentum that's growing for tackling these issues, and address them in a common platform. And this is the the red track at the bottom. We've got a twin track manifesto that we've launched at the FIA Foundation, and we're working with our UN partners and our donor colleagues on this agenda. As Saul said earlier, we've launched an advocacy hub for during UN Week, and on the red track at the bottom, it's really about shifting the approach for youth and adolescents globally, increasing the level of donor support so that it isn't 2.2% of the total which is spent on youth and adolescents, and it isn't fragmented and uncoordinated, but it is a far greater commitment for youth and adolescents, particularly as we look to recover and respond to COVID-19 and the economic and social ruin and impact that COVID-19 has wrought across countries globally, and particularly for our youth population, and to respond to what they need in terms of education and rights and well-being, and have a safe environment and road safety as part of that as well. So that's the youth and adolescent agenda, but really link that very strongly to this very focused, very concrete, tangible policy advocacy agenda around 30 kilometers per hour. And we see that as something really that is deliverable. As Saul said earlier, even in contexts where there aren't many resources, where you haven't got that much funding, what you can do is bring the speed down, and bring the speed down for young people, for children and vulnerable road users in communities and around schools as a priority. And to have that as a policy priority within this global summit for adolescents and youth is what we're aiming at. And it's a good issue because it connects in with wider agendas, with the wider climate agenda, looking to create environments that are much safer and much more conducive towards shifting to zero carbon travel, to walking and cycling, to reduce car dependency, and produce environments that are much more amenable to walking and cycling and protecting the vulnerable. And of course, getting our children to school safely and connecting them with the education agendas on that as well. And this is what it means on the ground in terms of having a safe environment for children, an approach where what we have is kind of three main areas: safe and healthy journey to school for every child, where children and traffic mix a default speed of no more than 30 kilometers per hour. Every city, every area where there are children, vulnerable road users, to have protected footpaths and protected cycle lanes. Julio actually spoke earlier and gave a great overview of IRAP, and actually IRAP research has found that in most roads where it's higher speed traffic, over 90% of roads don't have protective footpaths for pedestrians across low and middle income countries across the areas that they studied. So, you know, it's clearly an area that needs a lot more focus and attention from both governments and donors. And having that around this safe system that prioritizes vulnerable road users first, pedestrians and the vulnerable, and starting with our children. This young boy here, he's from Denham Town, just like the girls at the start of my presentation. And we were looking at what needed to be done around the schools in Denham Town, and also has our primary in Jamaica, and working with UNICEF and partners on that. And really around his school, we found that, you know, we could quite easily put in exactly the measures that I outlined in the slide before, that we could have protected footpaths, we could have measures to slow down the traffic. This boy here, his friend Naheem Barnett, was actually struck by a vehicle outside the school, and he suffered head injuries. And the only lucky part of this story was that the car was traveling at a slow enough speed, below 30 kilometers per hour, that it didn't cause him life-threatening injuries any faster, and he wouldn't have survived. And it shows that what can be done if we can reduce the speed around schools, if we can put the safety measures in. The Amend NGO that did an assessment around these schools, both in Kingston and just outside Kingston, had done research which found that if you were to put in safety measures, speed bumps, raised crossings, the kind of picture that Julio showed earlier, that similar to the measures that had been done in Lusaka in Zambia, you could reduce injuries by 25%. And those kinds of measures would cost around $20,000 per school. I mean, in the context of the kind of school infrastructure that would be put in place around the school, for schools and around schools, and in the context of some of the work that some of the development organizations do on areas like water sanitation and hygiene in schools around the world, that kind of investment is not a hugely high amount of investment for a school. And in terms of the amount of benefit for reducing injuries and fatalities and creating a much safer environment, what we're saying is obviously it needs to be a priority so that this little boy and his friend can get to school safely and can get the benefits of the education that they deserve. Thank you very much.
Thank you very much, Avi. That's really a wonderful answer to a question that will tug the hearts in Jamaica and across the world. We're all concerned about our children for one reason or another. And it would appear, based on your contribution and also from Julio, that it really should not cost that much money to make a huge difference in the lives of our children and our adults. And again, it comes back to questions raised by Etienne and Saul, that it's all about political will. And so therefore, in that context, we are very heartened that the Prime Minister has issued a call for action in this seminar, this webinar, and we hope that there will be some follow-up on this particular issue. So thanks very much, guys. We've been at it for a little while. We're going to move very quickly now, and I'm going to invite Manpreet Darroch from yours, a major global youth organization, to join us in this session. He has kindly consented to be part of a discussion about the next steps, because having had this very informative discussion about many issues that have been raised today, we need to proceed to look at a very important issue. That is the high-profile campaign to reduce road traffic injuries globally. The recently declared UN's second decade of road safety provides an answer to some of the questions that many would have raised in this webinar so far, and will raise in due course as we have the question and answer session to follow after this for a short time. So we're going to turn now to look with all four presenters plus Darroch, Manpreet Darroch, to look at the second decade of road safety. And to start us off on this aspect of the discussion, we're going to turn again to Dr. Crew to lead us. First of all, by stating briefly the results of the first decade of road safety, the lessons learned and the goals achieved, and then what are the expectations for the second decade. And I'm sure there are others who join in with other issues as we proceed. Dr. Crew?
Yeah, thanks so much, Lucian. A lot was achieved during the first decade in terms of results in some parts of the world. I'm thinking of Brazil, the Russian Federation, the European Union, which saw substantial decreases from 20, 30, up to 50% in road deaths over 1 decade, which is, of course, a very impressive result for relatively big countries or parts of the world. Unfortunately, not all countries saw that. At the contrary, we saw increases still in many countries, in most countries, particularly in the low and the lower middle income countries. But for the entire world, we really built, I think, a solid foundation, a more cohesive group of the international community, solid civil society engagement, and we've seen that throughout this week, including in Jamaica. Strong youth groups, and it's great we have our youth here represented as well in the form of Manpreet. So I think we have set ourselves up for a more results-oriented decade this time, where we will build on what has been achieved, what has been learned, but also I think be more vocal and bolder. We cannot continue having discussions even like this, where we have high-level political leaders join us and state their commitment and then not see the results. I think we have to be more demanding. We have to be more pushy and make sure that these political statements lead to real action. And at the same time, guide this action and support it. We have a strong network. We have Julio here to work on infrastructure with the IRAP. We have the FIA Foundation. We have so many players that we can count on to help with the implementation. Now it's just a question of doing it.
Manpreet, you want to unmute?
Yeah, sure.
That's so much a challenge. We need to be more vocal.
Oh yeah, 100%. Firstly, thank you.
You're a young person. Share with us your views. Yes.
I'm youngish, kind of. We're not going to go there, right? We're not going to talk about it, but that's okay. But the organization that I represent, firstly, thank you, Lucian, for the invitation to speak at this webinar. It's been a great week of action. And let's hope that we can continue this momentum for Streets for Life in our communities. And it was really interesting what Saul was saying about how a lot of streets and a lot of communities are built around this kind of view that children, young people should stay off the streets as for cars, right? Looking ahead to the next decade of action, we've seen some draft plans in terms of what's been proposed for the next decade. As Etienne said, there's a lot of important action that needs to happen, a lot of results-orientated action. And that's one thing that we're trying to do as a youth organization. The organization that I represent, yours, Youth for Road Safety, we have, off the momentum of Sweden, the third ministerial conference, and the second World Youth Assembly for Road Safety, which brought together nearly 200 young people from 70 countries, all demanding change on the roads, because too many young people have seen that enough is enough. Too many young people have seen that their peers being killed on the road, and the tragic effects that it has on communities around the world. So we, as the young people, are stepping up and claiming our space and saying, all right, politicians are saying what they need to say. Sometimes they say what they need to say just because it's the right thing to say, and not following up with action, right? So what we're saying is, we as young people, we're being killed on the roads, right? We're the biggest affected group when it comes to road traffic crashes. So why are we not also being listened to? Why are we not being given the tools and the support to go out there and campaign and to create policies that reflect the lives of young people? So that's what the Global Youth Coalition for Road Safety is doing. We've brought together already 450 plus young people from 93 countries who are all very passionate about road traffic crashes for a multitude of reasons. And it's, as your previous presenters have said, it's about placing it within the context of other SDGs, of the co-benefits that low speeds have, of what Action for Road Safety has for society as general. And it's about empowering those young people. We did a program just across the Caribbean Sea from where you are in Belize, where we asked a group of young people that we were training to be young peer educators in the country, how many young people do you know that have been killed on the road? And we asked them to stand up if they know somebody. We got to 3, we got to 4, we got to 5 young people. Some people even knew 6 of their peers who've been killed on the roads, which is, for me, brought up in a UK, relatively safe environment. I really find it really heartbreaking to see that young people are feeling the effects of this, seeing the effects of this firsthand, and yet we're still not included in the solution. So we say include young people in the solution. Young people have so much energy, so much creativity to be the energy that really takes this next decade of action forward and energizes this movement. And seeing young people, you saw it in Sweden yourself, Dr. Lucian. You saw the power and passion of young people to energize this global movement, and we need to really put money where our mouth is, and also support the movements of young people so that they can go forward and really take this issue forward.
Great. So, power and passion, is that going to be sufficient to put in place your vaccine, political will? We see where in Jamaica, certainly across the world, there's a lot of vaccine hesitancy. I'm sure there's a lot of hesitancy in terms of political will across the world from various governments and policymakers. Is there some structure within the second decade that with passion and commitment and advocacy and certainly the flow of funds into low-income countries that can encourage the political will that you speak about, the vaccine?
I don't really see it at the moment, and I think we have to be quite tactical. And I do entirely agree with Etienne that we probably need to be making more noise and being a bit less reasonable. And we've I've been doing this for 20 years now. And none of us are getting any younger, except maybe Manpreet. And we should be a bit less patient, I think. And there's this bit of a sense that you do the cycle and you do the same conferences and you get the ministers together every 5 years and they all make the promises. And of the ministers that come together, maybe 10% go away and actually act on what they've said, which is good, but it's not enough. And we don't really have the accountability mechanisms to follow up with them. And I think, in some countries, it's very difficult. In a sector that's starved of funding, I think NGOs quite often have to sort of make quite tough decisions about whether they're going to speak out against power or whether they're going to accept a little bit of funding from power in order to try and ameliorate the situation. And I completely understand that dilemma. But it does mean that in some ways, I think we're all to some extent captive of the sort of the political power structures that are perpetuating the problem that we're also trying to campaign against. And I'm sure that's the case in Jamaica as well. It is difficult to, on the one hand, you're inside the sort of the government structure as deputy chairman of the National Road Safety Council, but you're also sort of outside it to some extent as an activist, and it's a difficult balance to get right. So I think we have to be tactical. We have to look at opportunities. I think this 30 kilometers an hour is so powerful because it is a very tangible sort of example of what can be changed. And we're not asking governments to do everything. We're not asking them to put billions of dollars of funding into the whole road safety system. We're saying, here's one thing you can do today, this year, next year, that can make a huge difference. And I think if we can pick our battles like 30K, and there will be others like motorcycle helmets, like vehicle safety standards, we can pick off particular issues, make a big noise about it, get some allies on board. And I think we can make a difference in this second decade. And I think being part of the Sustainable Development Goals, as I said, Navi said, and Etienne said, and Julio's also said, all of us, I think, realize that being part of the SDGs, being part of that bigger community can have a big impact and can get some new allies and change the dynamic to some extent.
Right. So Abby, let's take us on that point a bit more. From where I come from in Jamaica, certainly there's an old saying that money makes the mayor run. Is it the insertion of the of road safety into the SDGs that's going to unlock the kind of funding to flow into low-income countries that will be an incentive for political action for the SARS vaccine to take place? Is that the answer, Abby?
Yeah, there's not necessarily an easy answer for how we're going to ensure, a hugely greater level of flow of funding into our issue. I think if we knew exactly the answer, we'd have solved it by now, and we could all go home and do something else, or just retire, or whatever we want to do. But I think it's about positioning ourselves for this second decade of action in the best way possible to, as Saul said, kind of pick off strategically some areas where actually, there can be some wins on this. Perhaps it doesn't need huge amounts of additional funding to start with, but there can at least be some momentum that's built, some progress that's made on a key area like 30 kilometers per hour. So we can show the wider community, the donors out there, the governments as well, that actually this is something that they can address effectively, relatively quickly, that it can have benefits. I think that, any donor, any financing institution, and any government as well needs to look at this as an area that has relevance to what they're already interested in and already working on. I think for too long in road safety, we've been boxed off in a corner, and we've kind of been in the worst examples of it. We've been in our own echo chamber, and obviously it's great that we've got today's event, but being able to speak to the wider world as much as possible, as we've done a bit during UN Week, but it's obviously something that needs to be built upon a bit more. To be able to find common cause, to be able to link in with other relevant areas, to be able to show those in power, the big financing institutions, the governments, how this is not just relevant, but essential to the kind of policy agendas that they're trying to advance. And actually, I think you said it earlier, Lucian, that there is an opportunity here with COVID in terms of how cities and governments are trying to build back better from COVID. There have been examples, like the example that Saul was showing earlier in Bogota, where cities have been responding to COVID and trying to put in what is at first often temporary measures for walking and cycling, but really shift away from the status quo, where it's faster roads for vehicles and faster traffic, and instead shifting towards pedestrians and cyclists. And obviously that feeds into an objective, a climate objective that has increasing momentum behind it as well. So the short answer is that we need in road safety ever more to link in with those agendas, with the climate agenda, with the youth agenda that I outlined earlier as well, with the movements for social justice that are increasingly having currency and power around the world. And road safety, legitimately connects into all of those agendas, but we need to, put more and more effort into making those connections and making those linkages if we are going to make fundamental shifts for this agenda, and if we are going to access the kinds of commitment and financing that is needed in order to drive road deaths and injuries down. We have an opportunity. There is an opportunity in the wake of COVID, and there is an opportunity with the climate agenda and youth agendas as well. And it's about being able to position ourselves and work strategically to be able to access that. The 30 kilometer per hour campaign that has been running through UN Week and is, I would emphasize, is going to be running beyond UN Week as well, is an excellent opportunity for all of that and for that kind of positioning to take place.
Right. Julio, what I'm hearing a lot of is, well, at least part of it, the low-hanging fruit. There are things we can do now. There are things that campaigners and road advocates and those of who are managers can do now. You mentioned early the UN Sustainable Development Goals, and you pointed us in that direction. can you want to expand a little bit on it in terms of from your position in Chile, in South America? What are your thoughts going forward for the decade of road safety, second decade?
I think this 30 km/h campaign, as it has been said here, it's very important because it sets a clear target based on science, Lucian. We know that at 30 km/h, the possibilities and the chances of a child or of a person to die or to get seriously injured are low. Therefore, we have to apply policies to make this happen. As we know, road safety in general is, we can divide it into, if we analyze the SAFE system, into having good vehicles, a good park of vehicles, also a good behavior of people, which you can attain by educational campaigns and communications, etc. And also you can achieve this because of a good infrastructure. So here's the question. Can the infrastructure play a role in supporting in this campaign of 30 km/h? And the answer is yes. The infrastructure can make a lot of things on the environment, not only inter-urban in roads, but also in urban environments. And there are a number of solutions that you can apply. I'm not talking also only about the speed bumps, for example, but there are elements of the design that you can apply as a policymaker in order to make the driver, the people, to slow down in an urban environment. So here we are not only talking about education and also about enforcement, which is a lot talked and discussed when countries discuss about this 30 km/h, but also, as I said before, the design of the infrastructure, the design of our streets, the design of the environment is very important to attain this slow down driving around cities and inter-urban as well roads.
Ma'am, people are going to let you close this part of the discussion before we move into a short session of question and answers. I'm going to ask you a question which maybe I haven't thought about, but let me throw it at you anyhow. We saw in the Arab Spring where young people were at the forefront of what happened in the Arab countries, and governments were overthrown and things changed. Similarly, we saw what happened in the US recently with all Black Lives Matter. Young people were galvanized and things changed. Are the young people of the world sufficiently stimulated by the need for us to reduce road deaths? Or is there something else that you need to trigger this kind of response from young people across the world? Is the SAFE system sufficient stimulus, or do you need something else?
That's a great question, really great question, Lucian. And I think, well, we can see undoubtedly the power of young people to overthrow corrupt regimes or to, to protest for their rights, as we saw in the United States. I think if we say what is missing, I think the passion and the power is there in the young people. And many young people actually don't realize themselves that they are campaigning for road safety, or they are part of the system that is calling for change. Because when I first got involved, talking from my own perspective, when I first got involved in road safety, it was because somebody who in my school was killed in a racing accident, a racing crash in the local area. And for me, I didn't really understand what the mechanism was, what the route is for change. How could I potentially do something as a young person, and how can I influence other young people? How can I make my peers aware of it? But I think the first bit is the way we work in yours as practitioners for road safety, but also galvanizing young people is through the 3-lens approach. So you can see young people as beneficiaries, as partners, or as leaders in road safety. But before we get to young people leading on road safety, on taking the message forward, taking the message to their ministers, taking the message to their local decision makers, we need to make that first contact with them, with young people. There's so many great youth groups out there, from the Greta campaigns, the climate change action, but it's about giving young people a route in, some participation, meaningful participation, listening to what they have to say, inviting them to the table. And if they're not being invited, is young people claiming their space. And that's the movement, what we're doing at the moment. That's the movement, the trajectory that we're on at the moment, is young people themselves coming forward and saying, we want to be part of this global youth coalition for road safety because we've had enough of people being killed on the road. So there is a movement that's growing bit by bit by bit, and we're hoping to expand to every country in the world, have young people in every country of the world. And we're getting there. The message is getting out there more and more as we connect with other social groups, as we connect with other social action groups and other SDGs that are directly related to road safety. But it's also about making road safety something that's relevant to young people's lives as well, because I think people don't realize that actually you're more likely to die on the road than you are anything else across the world, right? So as soon as young people are empowered with that knowledge, they think, okay, I need to do something about this. I want to make the peers in my community safe. I want to work with the local government, or I want to create local road safety campaigns. And there are lots and lots of campaigns happening around the world. It's just that we need more support, we need more funding, we need more people to believe in the power of youth to actually come forward and really take road safety forward from a youth perspective as well, and put young people at the center of the road safety system. As Saul was saying, when we start in the middle of the road safety system, put people first, everything else trickles out. And we think that young people are the missing link for reducing road traffic crashes around the world.
Great answer. Something for us to think about as we move into the a short question and answer session. I really want to thank you guys for taking the time out to come and to share with us. And I'm sure those who are listening on Nationwide News, those who have been watching on the YouTube of both Nationwide News and JN Foundation and the Facebook pages have been stimulated and challenged by the issues raised and the questions asked and the data presented. This has been a wonderful session, and I'm going to crave indulgence if you could just, if there are any, I was going to see if there are any questions that anybody wants to ask in the webinar. Let me just look and see if there are questions. I'm just throwing it out if anybody wants. We want to say thanks to Etienne, who had to leave to another meeting. I don't see very many questions here. Kevin, you want to help me, or Marie? Anybody want to raise a question? Just raise your hand. We know the protocols now.
I see one question, Lucian, about how do you think Jamaican youth can get involved?
Okay, great. Go ahead.
Oh, okay. I dropped myself in that one. Yeah, no problem. How can Jamaican youth get involved? Well, from what I understand, there are lots of structures already existing in Jamaica, from national youth councils to local youth councils, and I think from the first instance, it's about engaging with these groups and making them aware of road safety and its connection to their everyday life. Because, as was mentioned earlier, violence and crime is well documented amongst youth groups, and there are, again, action towards that as well. But road traffic crashes are still the single biggest killer of young people. So it's, again, I think from the first instance is engaging Jamaican youth structures or young people as beneficiaries of road safety information, so they understand in a way that's interesting, in a way that piques their interest, in a way that is engaging and creative. One of the things that we were really proud of in Sweden last year was we created this World Youth Assembly, second World Youth Assembly for road safety. But it wasn't just a sit-down conference. It was, You know, it included art, it included rap, it included music, it included street art, graffiti, and all the things that young people enjoy, but not necessarily linked to road safety. So it's about employing all these different tactics and tools, and engaging young people in the topic that will resonate with them as people who are, you know, members of society, but also have so many other public health concerns or so many other public health issues bombarded at them all the time. You know, so many different developmental topics that are thrown at them. So it's about engaging them in a way that's interactive, that's interesting, but also evidence-based, that's going to lead to actual change in road safety policies in their countries, or at least have young people actively involved in the topic.
Absolutely. Emma Lewis, I see your hand raised, and then Yvonne Piper, and I see Derval Malcolm, his hand was raised. Emma, you want to go ahead?
Actually, Lucian, that was my question about how to get Jamaican youth involved.
Oh, that's your question.
Yeah.
Okay. Yvonne Piper? Yvonne is still there? No?
Lucian, I can add to that if Emma had a question, similar question, and more can be said on this. I'll just very briefly, I mean, I just tell everybody about, we did some campaigning recently, actually with Manpreet's organisation, Youth for Road Safety, plus the Global Coalition of Youth for Road Safety, and also some young activists from Jamaica, Christina Monteith, and she's a producer with Talk Up Radio Jamaica, and she's been, as Manpreet said, I mean, she'd been working across different issues of concern to her and different issues of sustainable development. She'd become a member of the UN Youth Panel on sustainable development at a global level. Done work on issues of violence and sexual reproductive health and gender rights, but also road safety as well. And I think increasingly, and Manpreet was saying this, I know, you know, it's not that young people, unlike us, they don't seem to work in silos, and they don't seem to work in, you know, in limited areas, perhaps as the older generations. It's one of the things that is being done in a far better way by young people than by our generations and older generations. And they're looking at, you know, these issues as they link as a whole. And she was talking about how, you know, we need safer environments from violence and safer environments from road traffic injury at the same time. And, you know, these things shouldn't be looked at separately. Our governments tend to look at them separately. They tend to say, oh, we've got a huge problem with violence here, so we can't really deal with road safety quite so much. But actually, there are issues that connect both of them. There are issues, as we've looked at from the FIA Foundation, where we've looked at, you know, harassment of women and girls as they go out on public transport, as they go out to school and to work, and, you know, having a safer environment for them and listening to their needs and being able to have them help design the environment and help inform the policies, to have young people involved in policy making around road safety and around those issues, I think is something that needs to be taken on board a lot more seriously. It's something that we're working with our partners on globally with the push for a summit on adolescence and youth in 2023. And I think a lot could be done by actually really meaningfully engaging young people, not just having a consultation with them, but having them on a panel which helps design policy. Listen to people like Christina Monteith, who spoke really well. We involved her in the UN event recently, which included road safety amongst all of the issues, and look for a way that we can really have a bit of a paradigm shift on how policy making is done, so that we're not doing it in these very limited silos, so we're not fragmenting everything. We're actually bringing it together in a way that serves their young people's needs properly. So, I mean, I think, you know, that's an area that can be looked at, and it, you know, is young people are out there demanding it. People like Christina should be listened to and involved.
Right. Actually, you raise a very good point there, Avi. Recently, there was a Gleaner reporter. His name is, if I remember correctly, Laverne Barrett, who wrote an article in the Gleaner identifying and highlighting the connection between the transportation system and unlicensed taxi operators, what we call robots, and women and children being harassed and also in some cases kidnapped and robbed. So there's a connection there between the violence and road safety that you quite eloquently made, and something that we would recommend to our policymakers. Jean Lorichin asked a question if we're going to have a follow-up with our policymakers, and the answer is absolutely. We have a scheduled meeting with our Prime Minister, with the chairman, perhaps another month or two. And certainly some of the issues raised in this webinar will be discussed at that high level. And I know our Prime Minister well, he will certainly deal with them as he sees fit. And Mr. Jarrett, I know is back here, he's part of our committee to raise these questions. So I think we have had a very useful day, a very informative session. I think it has been a good contribution to the United Nations Global Week of Road Safety. I want to thank all of you. I want to thank you individually, Saul, Etienne, Avi, Manpreet, Julio, Paris, and of course, the peerless Zaleka. It still rings in my mind her position in Brasilia, no more excuses, which is something that we are talking about here that came out to the forefront. We have to find a way to encourage governments and policymakers and those who, sorry, there's a question from Durvan. Durvan, go ahead, please.
Hi, hello everybody. Just a quick one. How will this latest initiative fit within the new Road Traffic Act, which for which regulations are still being developed, or is it, well, go ahead, please, Mr. Joe.
Well, okay, so the Road Traffic Act, in essence, is something which the National Road Safety Council has been involved in. 12 our staff members, Mrs. Paula Fletcher and Victor Anderson, who have been very involved in the actual writing and organizing of the act. We are waiting the final position now. The act, as you know, was passed 2 years ago, is to be implemented. It is associated with another act, the Transport Authority Act, and you have to pass that one first, repeal the whole Road Traffic Act, and then implement. So we have gotten a date for August. So within the context of what we're discussing here, we're talking about safe road users, essentially. We're talking about safe speeds, and to a certain extent, safe roads. So it's a very integral part of the whole push, the whole campaign for road safety, along with a new and improved ticketing system, which the Minister of National Security has been fighting for. And we are hoping that certainly this year, both of those two important issues will be resolved, and we'll have them as part of our armamentarium to deal with road traffic crashes. Durban is a radio announcer to the panelists and a very influential media person. So his question is well served. So I was saying, as we move to a wrap, this has been certainly a very rewarding session for the entire country, for the Caribbean, for the Americas. Manpreet, you wanted to make a final point, did you?
No, I can if you want, but no, maybe I had my hand up. Sorry about that.
And by the way, and how is your child?
Fantastic. He's not making too much noise downstairs, so that's good.
Okay, I remember as I asked the question. So once again, guys, thank you ever so much. As we know, the association between ourselves here in Jamaica and you guys transcends just campaigning for road safety. We are friends, and we have traveled across the world and joined together to do a lot of things. And it's certainly a great joy to have had you here virtually. Hope one day when COVID is over, we can get together again. Thank you ever so much, and I was about to say, Godspeed as you journey back home, but of course you're home. And you just need to open the door and go back about your business. Thanks again to everybody who attended. Thanks to the team, the hardworking team who put all this together, led by Jean Laurie Chin and on one hand, and Paula Fletcher and Victor Anderson on the other hand. The media people, and we're going to follow this up. Thanks to Nationwide for broadcasting, for JN Foundation for the broadcast, for all those who attended the webinar. We commit to continue to follow this up. Thanks to Paris again, our national treasure, and thanks everybody. See you again sometime soon. Thanks very much.
Thank you, Lucian. Bye-bye.
Thank you, Julio. Thank you, Julio. Thank you so much.
Take care. Have a good day. Bye-bye.
Thanks very much. Bye.
Very much. Nice to see you all.
Thanks a lot. Bye.
Thank you. Bye. Earl. I don't think Earl is there.